The next talk is latest screening by Kanika, Dr. Kanika. Guest talk.
This is a guest talk. Uh, I think the next session people are already here, but unfortunately we started at 8:35. That is why. Hi.
A very good evening, a very good morning to everyone. So this is a very basic talk on how we are managing um, retinopathy of prematurity in a tier 4 city. And we are doing screening and treatment in a place in Uttarakhand, which doesn't have a retina surgeon around 100 kilometers from our center. And we have still attempted to treat and screen patients. So I would just like to share with you how we are doing it. I would like to thank Have a Heart Foundation, Narayan Netrale, and Dr. Anand Vinekar. Okay, so we all know what ROP is. It's a miserable disease of the premature children. This is how it's classified. So the screening modalities, we screen a baby who's less than 2 kgs of weight, less than 34 weeks prior if he's born, or any other systemic factor. So traditionally, it's indirect ophthalmoscopy, and the latest is photo documentation. Technique for both is the same. Pre-examination, 45 minutes prior to screening, we have to dilate. And this is how the conventional indirect ophthalmoscopy is done. And this is I don't have any financial disclosures, but in the current Indian market, we have the Forus Neo camera. And this is a very, it's a mobile camera. It's very easily transportable. And this is what the camera looks like. And it comes with a laptop. The benefit of photo documentation is the ophthalmologist is free to multitask, especially in tier 4 cities like me. We have other things also, so we have it's easy for us to do other works also. It's a quick and painless method because we don't need to depress. Hence, lesser staff is also used. Lesser litigation charges because we have proof, and we can have multiple consults with experts. So this is how this boy travels with this small camera in the attached case, and this is the our van, which he takes around 100 kilometers every 1 day in a week. So this is the video. This is how small the camera is, and it has the entire camera and the laptop, everything inside it. This is how the examination is done. So I think there is a little bit of a glitch in this thing. So maybe I will just show it from here. Yeah. So this is just how the examination is done. Okay. Okay. Yeah. So and this is how the pictures are stored. I will just go back to my presentation. I need to go back to the PPT. आगे नहीं जा रहा
कुछ नहीं है स्टेपलर वगैरह है
क्या होगा
हाँ ग्लू से हाँ we'll go to the office
ये है PPT
ग्लू वगैरह है कुछ सील करने के लिए टेप भी चलेगा
So the treatment considerations. So this seems like a very difficult algorithm, but the basic thing is that we follow up between 1 week to 2 to 3 weeks up till it needs treatment. And treatment is basically historically it's always been the laser therapy, And we go in for treatment when it's any stage, zone 1 with or without plus disease, and zone 2, stage 2 or 3 with plus disease or AROP. Now we've started giving, for quite some time now, anti-VGF therapies also in AROP. So this is one image of us injecting a baby, but it was so difficult to actually take a video. So it's not very clear. But it just has to be the usual, in adults it's usually between 3 to 4 mm. This is just 1 millimeter from the limbus. And if your needle is 4 mm, you can go till the hub. If it's 6 mm, then you go halfway through. Go absolutely straight because the lens is more globular in the child. This is the other eye. We really tried hard to get a better video, but it was... And we don't push the plunger ourselves. It's the assistant who actually pushes the plunger, because both our hands are busy. Okay, this is the pre and post injection images. This is around 3 weeks after this. We had to laser the patient because of PAR. It developed PAR later. Laser photocoagulation is done because it targets the avascular retina. This is where we do the laser. We try not to anesthetize the child, but in case the child becomes a little bigger, then it gets very difficult to do it without anesthesia, then we are forced to do it. Okay, so these are the pre and post laser images. And we don't have a vitrectomy and scleral buckling facility in our center, so we send our patients over to Narayan Nitralaya, Bangalore. And this is one of our patients who was sent over. This is operated by Dr. Sushma Jayana. And he was grade 5, the child. You can see the detachment here, the fibrovascular proliferation. We had lasered the patient and then sent the child over, but okay, this is the pre and post vitrectomy images. So post-treatment considerations are basically frequent follow-ups, refractive error management. The patient can develop amblyopia and strabismus, and of course the parents need to be screened very well. Thank you.
Yeah. So we conclude this session. Any speakers are there, presenters? We can come forward for a photograph.